Good afternoon, everyone. Thanks so much for joining today. My name is Topiata Poibi and I'm Head of the Achievement Program at Cancer Council Victoria. I'm really delighted to be here in the VicHealth studio today, where the Achievement Program and VicHealth have partnered to bring you today's online event, where we'll be exploring prevention in the age of COVID. But before we start, I'd like to acknowledge the traditional custodians of the land that we're meeting on today, the Wurundjeri people of the Kulin Nation. I'd like to pay my respects to elders past, present and emerging, and to thank the custodians for looking after the land for so many thousands of years. Today I'll be joined by an expert panel, but before we start, I'm going to flick to a recording with Maria Bubnic, the Assistant Director of Prevention and Population Health at the Department of Health and Human Services. She unfortunately couldn't join us live today, so here's a chat I had with her earlier.
Hi Maria, thanks for joining us today, especially this week, I think, where events have reminded us of exactly how much of a challenge that the COVID-19 pandemic is causing. So can you start by telling us a bit about your experience working in the health sector during the COVID-19 pandemic?
And it's a real pleasure to be part of this event, and as you say, timing is everything, and it's a terrific opportunity for us to reflect as we continue to navigate the various challenges that COVID-19 poses for us. In terms of my own experience within the Department of Health and Human Services, as you can imagine, many of us have been redeployed to the actual COVID-19 response for a number of months, and this is pretty much mirrored across the sector. Despite this, key priorities around prevention and population health have not only continued to be priorities, but have been spotlighted in the context of how we mobilise communities to engage with the COVID-19 public health messaging and response. Our own Victorian Chief Health Officer, Professor Brett Sutton, and the Deputy Chief Health Officer, Annalise Van Diemen, have both been significantly the public face of the department as part of our successful response to the pandemic to date. And the army of people that have been working behind them goes without saying, but there's certainly been a number of opportunities to express our gratitude for the 1,000 and more contact tracers that are working steadfastly as each case is identified. And again, as you reflected, this week poses additional challenges and reminds us of how important these contact tracers are as we see community transmissions increase. So while the pandemic response has been the primary focus, our Chief Health Officer has continued to ensure that other alerts around significant public health issues have been timely, and a number of things have been occurring alongside COVID-19, as you can imagine, including hepatitis A. We've had an outbreak of that, new measles cases, and various risks around poisonous mushrooms growing in parts of Melbourne. So too, we've seen some specific messaging around trying to engage people in their health care and managing existing chronic diseases and other illnesses, as we've seen a disruption to some services like breast screening, as well as reduced health-seeking behaviour within primary care. Other key messages have obviously been around how people can minimise their risks of COVID transmission, and a lot of the public messaging around that has included people keeping active, eating well, and even now being an excellent time if they are smoking to quit smoking, as it may increase the severity of symptoms if they contract the virus. Probably just finally to say, we owe our successful management of the pandemic to date to public health and health promotion experts, as well as health and other professionals in the sector. We have been leveraging to the extent possible technology, including telehealth, as we've moved to rapidly adapt and pivot delivery models to deliver health promotion, prevention and healthcare messages via these means to continue to reach some of our at-risk groups and populations in community.
Thank you so much, Maria. And I know that many tuning in today have been part of the response and the army of people working behind the scenes that you mentioned. So what would you say some of the key things that we've learnt during the pandemic are?
The pandemic has had some both positive and negative health-related impacts on Victorians. In the last few months, it's been somewhat disruptive to our usual ways of living, working, playing, studying, but we've also seen numerous examples of innovation and positive changes in personal behaviours. Our evidence-based world-class public health response has meant that the states and territories, with the support of the Commonwealth, have been able to drive significant population behaviour change. It's a great example of mobilising community to change the behaviours of whole populations very quickly and reaping the positive health outcomes by, as many would say, smashing that curve. Consistent messaging from trusted health professionals has been critical in this, and that includes people in the audience today. Despite this, there have been a number of negative economic and health consequences playing out, including social consequences, as we've seen the significant disruption to people's job security, housing security and food security. So we've obviously been keen to monitor that, look at opportunities to engage with community around doing things differently in order to support people's health, social and economic needs. I think the other interesting data we're seeing to help us understand some of the positive and negative impacts of COVID has been a recent Monash University study which looked at which found that 40% of participants reported their sleep was more consistent with their body clock now. And we know that poor sleeping is linked to unhealthier and increased eating, as well as low interest in exercise. And some people have reduced their activity given the restrictions. I know we often, when we head out for a walk or a run or a bike ride, we feel that there are many more people than normal, but there's also a growing group of people who are working from home and finding the demands of that mean, and alongside some of the homeschooling that we've had for a period of time, has created challenges for people to be able to be active. So we've looked at some circuit breakers around that, and we've seen an increase in the number of virtual, innovative approaches to people doing Zumba and yoga classes, amongst other things, and helping people in nursing homes, for example, to do exercises and stay connected with families. I think the most recent survey I've looked at from the Australian Bureau of Statistics for the period of 29th of April to 4th of May this year has shown some positive behaviour changes in terms of people eating more fruit and vegetables and decreasing their takeaway or delivered meals by a third. But at the same time, reporting that things like alcohol consumption, eating more snacks and lollies, and loneliness were much higher, particularly for women. So in amongst all of that data, there's clearly some groups that are benefiting from being able to increase their health promoting behaviour, but there are other groups that we've seen a downward trend on that front. And if you overlay that with what we're seeing in terms of the economic impacts of COVID, you start to understand the sort of widening potential of the social divide, particularly in some population groups who are already disadvantaged and don't have ready access to the sort of digital technology that has helped people to remain engaged and connected with both work but also socially, and with some of the health promotion resources that I've just outlined. I think for me, the pandemic, shines quite a spotlight on public health and health promotion, and the importance of smoking and obesity as two significant related conditions that are key risk factors for the severity of COVID-19 cases from the data we're seeing across Europe, the States, and elsewhere. So probably, I think there's certainly a desire to continue to capture this unique experience and the importance of keeping messaging and reinforcing messaging in different ways, I think is going to be critical, particularly as we've seen with the discussion this week with community transmissions, how we better connect and reach out to different cultural groups in community has become increasingly important.
Thank you so much, Maria, and some really interesting statistics in there, some of which may not have been expected. What would you say, from your perspective, the key priorities are as we go into the future?
There's certainly been some discussion around we've been, lock steady in a COVID response, and can continue to be, at least in some part. And are we moving into COVID recovery? And I think, given that COVID continues to, be such a significant force in terms of, the risk continues to be there, and we're seeing some changes in the impacts on the Victorian community. I think resilience is a better term. So I like COVID, not necessarily response, but resilience and reform as sort of what's on the horizon, what should we prioritise going ahead. And I think that resilience is resilience of individuals, communities, the service system, and our capacity to continue to adapt, be sufficiently flexible and responsive, and maintain a close understanding of what some of the positive as well as the unintended consequences are of the various interventions or strategies we're undertaking. I'm really quite struck at just how much evidence is emerging around the obesity and related conditions like diabetes and cardiovascular disease coming up as amongst the most significant risk factors for the severity of COVID, and obesity alone appearing to shift the severity of the disease to a younger cohort. I think they remain significant public health priorities for Victoria, for the nation, and globally. And I think, if anything, we'll continue to reinforce and strengthen what we are doing in that space. And I know the Minister for Health, Minister Makakos, has certainly made a commitment to a focus on childhood obesity prevention in particular. Partnerships with our stakeholders are obviously really critical in developing this resilience and promoting opportunities for reform and innovation as we learn to live in the new normal. Together with community, I think we can co-design opportunities to ensure that prevention is much more embedded in the types of contacts people have with healthcare professionals. and for that to be embedded in such a way that it's much more systematic rather than ad hoc and fragmented. I think we need to consider opportunities to resource a number of people in the community to have the technologies and access to some of these services in ways that sometimes we forget. And I think a recent mental health budget announcement really shone a light on that, in terms of literally handing out phones with SIM cards and mobile plans, and some opportunity to engage on video consult with their healthcare provider. I think resourcing people to be able to engage and to mobilise their active engagement in that care is critical. So I think, if anything, there's a sense of momentum from my perspective, and using this momentum for change and adaptation is really critical in addressing some of the priorities that I think the prevention and public health sector has known for a long time, but we now have the biggest spotlight shown on it, that we have a terrific opportunity, and I feel very privileged to be part of that opportunity in looking at what collective impact we can have going forward.
Thank you so much, Maria. And I think that the concept of resilience is, at all levels, is one that's hugely appropriate and fitting. And once again, thank you so much for your time today, especially during this busy week.
I really appreciate it, and as I said, it's a privilege, and I hope that the webinar is as stimulating for everyone. So thank you.
Thanks so much, and I think that Maria's point, as I said, about resilience and also carrying forward the momentum, provide a really nice segue into the discussion that we're about to have. I'll introduce our panel members now. So we have Todd Harper, CEO of Cancer Council Victoria and President of the NCD Alliance. We have Jane Martin, who's the Executive Director of the Obesity Policy Coalition and Alcohol and Tobacco Programs at Cancer Council Victoria. We have Sarah Khan from Sunraysia Community Health, and Dr. Sandro Demaio, CEO of VicHealth, who's joining me in the studio today. So as we move through the discussion today, please post your questions in Slido, and we'll try and get to them if time permits right at the end of the session. If you have any technical issues as well, please post that in Slido and we'll try and help. So Sandro, we heard Maria talk a bit about the importance of engaging disadvantaged groups and ensuring that the social divide doesn't widen further post-COVID, and equity is a theme that we'll be hearing a lot about this afternoon. I know at VicHealth you had an important discussion last week as part of your Good Food for All event. And from that, what do you see as the opportunities to address food insecurities here in Victoria?
Yeah, that's a great question. First of all, thanks very much for having me. It's great to be joining such an all-star cast. And I've always wanted to be live from the studio, so to be able to say that is very cool. Look, yeah, we did have a great conversation last week with hundreds of people from across the Victorian community about how we can achieve that vision of good food for all. We know that around 2 in 3 Victorians are malnourished in some way. We have high rates of ongoing unhealthy weight affecting all parts of society, but with a strong socioeconomic gradient. We know that about a quarter of our children are above a healthy weight, a healthy weight, living with an unhealthy weight, and that has huge implications for their health, but also for many other aspects of health equity. We also know that 1 in 7 Victorians continue to be food insecure, and I think this is something we often overlook. We think of malnutrition, or we think of food issues in Australia as being one of predominantly eating too much of the wrong types of food, or access to healthy foods, but actually access to food at all is a big issue for Victoria and something we need to continue to be cognizant of and address. But I think above all, food and nutrition is a great litmus for health and health equity in general. It's the canary in the mine of chronic disease. And I think, look, what came out of these conversations is that there are a lot of opportunities, but there are also a lot of challenges. There are a lot of really positive ways that we have seen the nutrition of communities change across the coronavirus period. You know, in one way, we haven't been you know, commuting long distances past 9, 10, 15 fast food outlets in each direction to and from work or school. We've seen dramatic reductions in sales of sugary beverages across the world, as well as, I believe, here in Australia. We've seen many of our fast food outlets having lower or limited service, which is meant for many Victorians, they've you know, been stuck in the kitchen, so to speak, and reconnected with food. We've seen more Victorians experimenting with food. We've seen, in fact, sourdough baking one of the #1 Googled terms or phrases across the world over the last couple of months. There have literally been millions of people trying to make sourdough for the first time. So there have been lots of really positive things that we might want to hold on to, but there have also been a lot of negative influences on the nutrition of Victorians, but also on particularly the equity of nutrition in Victorians. And of course, this comes back to the close relationship between good food and your income, and the sad fact that, you know, the unacceptable fact that nutritional status in Victoria continues to be largely dictated by your income and your postcode, which is something we need to change. So if I think out, you know, going forward, I like to think of the coronavirus, you know, and the changes that we've experienced across 3 planes. What are the things that we want to retain? What are the things that we want to vehemently push back and not see continue? And what are the things that we want to accelerate? I think there are a lot of things we want to retain. You know, giving people the opportunity to try, to the time, but also the access to be able to, you know, cook and reconnect with food. You know, more flexible working hours, commuting less of a distance has really resulted in many Victorians having more time to cook, but also share food, which is really critical to many parts of, you know, social and mental well-being. I think there are also many things that we want to try and push back. I certainly don't want to see McDonald's continuing to sell milk and bread at the fast food. I don't think that helps anyone. We also, you know, will see and have seen with loss of jobs and the greater economic hardship that's happened as a result of coronavirus, it is very likely to get worse, an acceleration or even a widening of food inequality and nutritional inequality across Victoria. So that's something we're really going to have to double down our efforts on over the next 12 months, 24 months to make sure that that canary in the mine doesn't become a much bigger problem as the economic drivers leave more Victorians behind. But then there are things we want to accelerate, and one example is VicHealth's recent investment with the Community Grocer, which is a program of providing heavily discounted but also culturally appropriate food in many migrant-heavy communities, in lower-income communities across Victoria. And so we've been really wanting to accelerate some of those programs, scale some of those programs to more communities to give them better access to affordable, fresh and healthy food that's culturally appropriate. But there are loads of other great programs that we want to see scale through and beyond coronavirus. And I think another example is the work that Oz Harvest has been doing, you know, delivering thousands of boxes, fresh food boxes, a program that didn't exist before coronavirus, but because of the huge surge in interest in the public, particularly in middle income families for getting fresh food delivered to their door, they've been able to pivot their work and take advantage of that sort of market-driven opportunity to scale what I think is a really important program, and we're looking at how we can help them to scale even further into lower-income communities across Victoria going forward.
Thanks so much, Sandro, and hearing about those great initiatives makes me reflect on the coalition of over 200 organisations who recently signed an open letter raising concerns about food insecurity in remote Aboriginal communities and calling for a guarantee for affordable food and other items in those communities. So if I could now turn to Todd Harper, CEO of Cancer Council Victoria. So there are many competing priorities in our society right now, with the situation continuing to change every day. You know, we've seen that just even in the last few days. So given this, why is prevention more important than ever?
Thanks, Topi, and thank you for organising today's session. Look, I think one of the things that this current situation has reminded us of is that shocks to our society, be they conflict, health, economic, always affect the most vulnerable in our community. Those low SES, those living with conditions such as cancer, diabetes and heart disease, who often have the less capacity to be able to respond to shocks that we see in our healthcare system. And so I think what we're going to see increasingly emerge out of this is the importance of those really strong healthcare systems, universal health coverage that prioritise, strengthen our health systems, including prevention, treatment, early detection, palliative care and so forth. So that's going to be particularly important. And it's those countries globally which have those systems in place, which, no surprise, are doing better in the current pandemic. And prevention has a particularly critical role to play. And so for those who are advocating in prevention, I think there are three particular themes that I would focus on. The first, of course, is that we know prevention, the right prevention strategies are affordable. And in fact, the costs of inaction with prevention can be catastrophic to our society. And we're seeing that in Australia and we're seeing that globally as well. Prevention gives us the opportunity to drive those health outcomes in society. So that's important from an efficiency perspective. From an equity perspective, we know also that prevention is particularly effective in improving health inequities. So we think about those big population health programs. They are able to not only drive outcomes at a population level, but with targeted strategies are also able to improve health equity outcomes, whether it be tobacco, whether it be UV, whether it be HIV/AIDS, for example. So those equity components are particularly important. We also know that prevention literally is often better than the cure, and that's particularly the case where we have inadequate treatments at our disposal, and COVID-19 is a particularly powerful example of that. It is often the most important way that we have to treat disease by, in fact, stopping disease before it starts and stopping the consequences of that disease. So the lessons I think we'll take out of this is the importance of strong healthcare systems, strong universal health coverage, and make sure that prevention is a key plank of our health systems going forward, both from an efficiency perspective, an economic perspective, and also because an effectiveness perspective.
Thanks so much, Todd, and I'm sure that there are people tuning in who may be in a position where they're needing to advocate, so I think that those three points make a very powerful argument. So Sandro, already we've heard a lot this session about the societal costs of the pandemic. Some recent research coming out of the Burnett Institute indicates that young people may indeed bear a disproportionately large burden of the societal costs of the pandemic and the related responses. So if we talk about the mental well-being of young people for a minute, as health promotion professionals, what areas do you see the sector needs to focus on to support them as they may be struggling?
Yeah, look, this is a great question. And I think there are some things we need to think about before we start getting to the solutions space. And the first is that, all too often solutions are created for young people and not with or even better by young people. We often talk about giving young people a seat at the table or ensuring they have a voice, but, all too often it's tokenistic. The decisions are already made when the table is set. And I think this leaves young people, this leaves all people, regardless of their age, let's be honest, if they're not given a voice, if they're not given a meaningful role, if they're not actually put in the driver's seat, then they don't feel empowered, and very often the solution is probably not actually appropriate, and maybe at best it's less effective than it could have been. So I think the first thing to realise, is that yes, young people are going to be hardest hit. The direct risk posed by coronavirus has been framed very successfully as something that threatens older people. But I think that narrative has hidden the indirect costs, the indirect health consequences of this pandemic, the mental health effects, the effects of isolation, but also the enormous consequences that are going to be driven, that we're going to see for years to come in the health of particularly young people as a result of the social determinants that have been affected by the pandemic, and particularly, I mean income and I mean jobs. When I speak to young people, what they were worried about before the pandemic was, big health challenges like climate change. They were worried about the mental health of of other young people around them, but most of all, they were worried about jobs. They were worried about their own economic future. They were worried about having a meaningful job and all of the opportunities, direct and indirect, but also health that come with that. I think for young people now to be staring down the barrel of, 10, 20 something percent, even 30 something percent unemployment, they're now estimating in some young demographics across Australia and here in Victoria. That's a huge issue. That is a health issue. That is a health issue for young people, and young people need to be really designing what we do, in terms of solutions. So first and foremost, they need to really be in the driver's seat making the decisions. We need to be empowering them to do that and giving them the opportunity to do that by stepping aside and by providing resources. That's why on Wednesday we're convening 10 young people from across Victoria, diverse young people with our friends at YACVIC, the Youth Affairs Council of Victoria. And this is an expert advisory panel directly to me and to VicHealth to make sure that over the next 12 months, the investments that we're making in post-coronavirus recovery, but also all of our investments as VicHealth are informed by young people, are led by young people and are owned by young people, and they will continue to drive and inform that agenda over the coming years. The second thing I think is the way that we communicate the health issues themselves. So before, again, we even get to solutions, I'll wrap this up, I promise, is making sure that the way we communicate, I think we've done a lot of things really well during the pandemic. I think one thing that we probably haven't done as well as a prevention community is really communicating in a way that is meaningful to the lived experience, but also just the life of young people. I think we haven't done a great job of that. I think we need to learn from that. I think we need to improve on that. We need to kind of build the plane as we fly it, because we're already still in a pandemic, and we need to make sure we reach young people, with young people, through young people. But we also need to know, we also need to make sure we don't repeat these mistakes going forward with regards to future challenges. So making sure that those communication channels are the ones where young people are, that we're communicating, that young people are communicating to young people, not us trying to communicate necessarily, and that it's meaningful and it resonates, and that the call to action is relevant. In terms of the solutions themselves, look, all I will say is there are so many great organisations working in this space. A big part of what I see our role as VicHealth is to get out of the way and support them to do great work. I think we need to make sure that prevention continues to be a big focus, not just as we come out of coronavirus, but also with regards to the ongoing and soon to be reported Royal Commission here in Victoria. Prevention needs to be a big focus, and we need to help to make sure that prevention and the social determinants don't end up being some sort of esoteric, nebulous, meaningless jargon, but actually it's meaningful and it's impactful for young people. So if we're talking about the health of young people going forward, if we're talking about prevention, we as a community need to be talking about economic recovery in a way that is respectful to younger generations and future generations. We need to be talking about an economy that's inclusive, that's that gives young people a sense of inspiration and aspiration, doesn't leave them out in the cold and feeling despondent. And most of all, we need to make sure that they have not just a seat at the table, but they're in the driving seat.
Thanks, Sandro. Some really important points there, and I especially like your point that the social determinants of health need to be really properly taken into consideration and not just an esoteric talking point. With regard to the social determinants of health, a newer concept around the commercial determinants of health has come around recently, and I want to pass over to Jane Martin, Executive Director of the Obesity Policy Coalition. Jane, this concept of the commercial determinants of health, could you explain a little bit about that and tell us about what you've observed in this regard during the COVID-19 crisis?
Sure. Hi, everybody. I feel like I'm at my first party or something for months, so I wish I could see you all, but it's nice to be part of something like this and to discuss these really important issues. So thank you very much for inviting me. So the commercial determinants of health really are the strategies and approaches that are used by the private sector to promote products and choices that are detrimental to our health. And it reflects a global understanding of how these commercial industries influence how we behave and what we eat. And there's a number of ways in which companies have in the past and right now are pivoting around COVID. I had to use that word, but certainly it's something that these large companies are very much focusing on and seeing this disruption as an opportunity. And Sandro referred to the example of McDonald's becoming a purveyor of milk and bread. So you end up at the drive-through and you may get fries with your bread, which you may not necessarily want. But that kind of idea of how companies can engage and be relevant at a time when the situation has changed dramatically is incredibly powerful. And marketing is one way in which these industries operate. And I think we've seen an incredible change in how companies are marketing. Some have reduced their marketing, but other companies like alcohol companies have come in with home delivery, particularly marketing to young people through Facebook. And some of this has been documented by VicHealth, by the Cancer Council in Western Australia and by the Foundation for Alcohol Research and Education. The industries also, these industries lobby hard all the time, but even now they're continuing to fight policies that might impact on how they behave. So we've seen this developing right now around the implementation of mandatory pregnancy warning labels on alcohol products. So we've seen the alcohol industry argue for no further imposts on industries such as the wine industry in Victoria, which has been hit by bushfires, and they don't want to, and they're using this and the COVID epidemic to argue against any further commercial imposts, despite this being run for around 11 years, despite industry having the opportunity to do it voluntarily. Corporate social responsibility is also an important part of the commercial determinants of health and how these companies operate. And we've seen this with Krispy Kremes being offered to frontline workers in hospitals, the last thing they need to stay healthy themselves. McCafe offering coffees to frontline workers, and often these deliveries of Domino's pizzas, we've seen them on news feeds, on our Twitter feeds, and it's all very, very valuable corporate promotion for these companies. And the other issue that Topi referred to is around supply chains, which are incredibly valuable and which these unhealthy industries are very, very good at. If anyone's been out to remote communities, there's often no fresh food on the shelves, but there's always Coca-Cola. And these companies make sure that they can get to these places which can be challenging. And the food security issue has been a really serious problem, particularly in rural and remote communities, because these kinds of disruptions that we've been through show where the cracks are in our supply chains, for example. And I think it's really important that we've seen a response, and Ken Wyatt has opened an inquiry now into the provision of food in these remote communities in particular. And this has been a problem for many years. Over the last 10 years, for example, we've seen the price rise in remote communities by 38% compared to 5% in regional centres. So that's just one example of how we're looking to change the system to reduce the influence of these commercial determinants of health, to really ensure that the community has an opportunity to build their health resilience and to have access to the services and the foods and other supplies that they need to stay healthy.
Thanks so much, Jane. And I'm sure it's a fascinating time for you and your staff at the OPC looking at the different tactics that are now being put in place by industry. Changing track a bit, I'm going to go back to Todd. So Todd, you're currently president of the NCD Alliance, which means I'm sure you've got some great insights into the global picture when it comes to prevention priorities in the COVID age, and we're thinking about the next chapter. So what have you heard, and are there any lessons for Victoria?
Oh, undoubtedly. And I think what we've seen, Topi, is what started as a health issue, but it has rapidly become an economic issue. It's an issue that is exacerbating poverty. It's exacerbating the health issues faced by the disadvantaged in our community. So these are quite profound challenges. Picking up on some of the themes that Jane just mentioned, it's been no accident that globally we've seen a shift in the marketing and corporate and social responsibility activities of the ultra-processed food industry, the alcohol industry, gambling industries to be bombarding us with these messages during a period of vulnerability for the population. I think what we're also seeing is the opportunity for to rethink about what is the type of healthcare system that we want to see beyond COVID-19. So there's some really important matters that I think that come out of this in a very, very powerful and tangible way. Health and health promotion is now very much linked to the economic fortunes of our economies. So we now understand that the impact of poor health systems can have on economic prospects. So that's going to mean that there's going to be an increased focus by governments worldwide, I think, in terms of what are the core building blocks for our healthcare systems going forward? What are the opportunities for prevention? Prevention is particularly important, as I said, when you don't have effective treatments available. I think the other thing that we've seen in recent times is the importance of good political leadership. I certainly hope and I believe that our political leaders will be looking at those societies where political leadership has been lacking and the health outcomes are there as a result. Contrast that with economies and health systems such as New Zealand, where we've seen strong political leadership, a strong focus on universal health coverage and good healthcare systems. That type of political leadership is providing not only more equitable and advanced health outcomes, but it's also, I think, a path to better economies as well. I think what we've also seen during this period globally is that the health of our most vulnerable populations really matters. It really matters in terms of the health outcomes for those communities. It matters in terms of the broader economic impact. And we've also seen the recognition that those people who are performing the really important tasks, like cleaners, like those working at supermarkets, these now become the important symbols of frontline response to strong economies, and protecting those people has really been emphasised, I think, during this period. I think the other thing that we inevitably will see is the incorporation of and discussion of values back into our healthcare system. What's the type of healthcare system that we want to see? What are the types of elements of our healthcare system that are going to be really important? I think we will see, and I hope that we will see, a focus on equity, a focus on addressing the commercial determinants of health, a focus on universal health coverage, a focus for communities to become more engaged in their health systems and their political leadership. I think these are some of the opportunities that we have, and it's really up to us as practitioners of healthcare to be the ones that are driving this change and calling for the political leadership that we will need to see going forward. I think what this has also shown is the importance of being in this game for the longer term, being sustained in our approaches to health promotion, recognising that complacency really has no place. The successes that we see in prevention often take years and even decades to be successful. We need to be thinking about that sort of time frame for the way that we build our healthcare systems for the future.
Thanks so much, Todd, and that sort of call to action really highlights that a response is really required at all levels. And if I go back to Jane then, given that all levels are really required in this response and recovery, all sectors, from your perspective, what does it look like when we think about prevention efforts post-COVID at all levels?
Yes, and it was a great segue by Todd. We didn't organise that, but that was really helpful, because I think it is about building the relevant structures and funding within government to enable investment in effective and long-term prevention programs and policies, so that we have an opportunity to shift the dial. We know where we're vulnerable, but we want to build that resilience. And I think we've seen some of the things that will address the social and economic determinants of health and help to address disparities being shifted very quickly. So with JobKeeper, we've been running the Raise the Rate campaign, but this goes to that. With inequity in Indigenous groups, with Closing the Gap, all those elements are really critical to address to make the kind of changes that we need to see to reduce inequity in our society. And it's not that we don't know what to do, it's more that we're not doing it. So the implementation of these plans and all the hard work that's gone into them is really critical going forward. And I think we've seen a fantastic response by our state in prevention in the past, but also with the COVID-19 pandemic. And as Todd was talking about, this is a long history, but we do have that leadership in Victoria in tobacco control and road safety, to name two elements. And I would expect to see that leadership reflected and flow through to future initiatives, such as the flag strategy by the government to address childhood obesity. But I think, Sandro's point about empowering and having active communities, he was talking about young people, but more generally is really important. And our public health and wellbeing plan in Victoria goes to that. And that's where we have some key players who can press the levers to improve the health of their communities in a way that's relevant and pertinent to their communities, addressing the issues that are real for them, because we know how important that is in seeing how the government is now responding to particular communities with COVID-19. So that active engagement by communities to make change in a way that's relevant and timely to how they live, work and play, I think is really important to prevention overall in Victoria.
Thanks so much, Jane. And I think that leads really nicely into the next session. For the next 5 minutes, we're going to hear from Sarah at Sunraysia Community Health and hear about health promotion in practice there and what they've been doing throughout the crisis so far and what they plan to do. So Sarah, Can you tell us a bit about Sunraysia Community Health and the health promotion activities that you've done as an achievement program member in response to COVID?
Absolutely, Toby, and thanks so much. I'm really excited to represent our organisation today. So I am the chair of our Staff Health and Wellbeing Subcommittee. We are a primary healthcare organisation in Mildura. We are in northwestern Victoria. It is a regional oasis on the river. So come and visit us. Just don't bring anything dodgy with you. We have a population of about 60,000 people, and our organisation has about 216 staff members. And at the moment, we are running a respiratory assessment clinic, and as of last Monday, have tested 1,058 people. So in regards to what we've been up to, I'll get Duncan to put that slide up. We have been doing a lot in the health and wellbeing space, and we will continue to do so. And a big reason because we have been doing a lot is we've been registered with the Achievement Program for 8 years. So we have a really strong organisational culture in regards to staff health and wellbeing. We have achieved 2 priority areas, healthy eating and more recently physical activity and movement. And we're working towards at the moment, which is really important, especially in the current climate, mental health and wellbeing. So with the healthy eating benchmark, it's the biggest fish is our healthy catering handbook, which Jade, our public health nutritionist, recently has upgraded and got 13 caterers on board. It aligns with the Healthy Eating Advisory Service and Food Checker, and then of course the Healthy Choice Guidelines. So we use that as an internal policy, and we have to be ninjas around the promotion of this healthy eating benchmark, because it is a really tough one to get everyone on board with. And Jane was mentioning, about the food and how much we're manipulated, and it's a continual conversations that we need to have with our staff. And I'm really grateful that we've got that benchmark and that we've had it for a long period of time. But if I was to be starting now, I would start with the mental health and wellbeing one, as there's so much existing capacity, certainly in our organisation around that. And when you talk about that one, you'll see a lot of head nodding to get people on board. But the other benchmark we have achieved is the physical activity and movement one. So there's a lot of moving parts, as you can imagine, with that one. We have sit to standing desks, we have centralised printing stations, we have change rooms with showers, bike racks. We encourage our staff to use active transport all the time, and we conduct walk-in meetings. We take over our local park run, all volunteer positions, twice a year. We have an e-bike as part of our fleet booking system. We run weekly Heart Foundation walking groups, and we annually participate in a 10,000 steps challenge, which last year had 1,400 community members and 71 staff participate in, and other things like the push-up challenge and the biennial MS Swimathon. So we have a great foundation that has enabled our organisation to kick butt during COVID. Our leadership is really supportive of the Achievement Program, and recently our CEO actually, firstly, she's a member on our Staff Health and Wellbeing Committee, which is really important for us. And then when COVID happened, Simone called all of our staff in the first week or the first few weeks just to check in. So we have really strong leadership, and so the platform that's helped us create some really good responses, and I cannot take credit for that as the chair of the committee. They've come through exec, they've come through HR, and they've come through marketing. So we really have a supportive environment for healthy staff. Next slide, Duncan. Yep, we're on there. All right, so as I said, our staff health and wellbeing is everywhere, and I was certainly really proud to see it all happening. So existing channels, it includes in our exec news and meetings, which were increased in frequency when COVID hit, and in particular, the meetings moved from fortnightly to weekly to help reassure staff about their job security and discuss alternate models of care and keep our staff connected. We also did a lot of new things, and we tailored new communication channels. The two big ones were our daily staff bulletins, which importantly included the data from the Chief Health Officer, Q&A, and also a lot of healthy eating, healthy exercise tips, brain teasers and jokes. So the other big one was our daily social media posts using Facebook and Instagram to help inform our staff and our community. So they were on self-care, and they also promoted our COVID clinic. And since April, we've had about 2,000 more followers on our social space. And the last one I want to mention is got to do with the slide that I have up, because I think that's perhaps one of our most exciting things that we have achieved, because it's been mentioned, you know, we're adapting this model. So this was created by a couple of our physicians in our physical health team. It's called Chs Connection. It was a daily physical activity and mental health Zoom session and promotion for all staff to take their breaks. Our executive assistant sent it out to all staff. So there was an Outlook reminder if they weren't able to come to the Zoom, just to literally take their break and take care of themselves. So what's happening with this one now is that we're transitioning it back to the workplace. The walks on Tuesday are coming back to our Heart Foundation walking group at 12 noon, and the Wednesday sessions are transitioning into the community. And for this month, we have been doing a live cross with ABC Radio. It's played every morning. We just have to do a recording once a week, but it's a bit of a shine on the physical activity recommendations, as well as a really short exercise to get everyone up and going. So yeah, that's at 7:45 every morning. So that's one I'm really proud about, Topi.
Sarah, for that, and I'm sure everyone enjoyed hearing those real world examples as much as I did. So going to questions now in our last few minutes, and I'll direct this one to Sandro. So a question from the audience: do you think that COVID reinforces the need to focus efforts on the social determinants of health rather than more downstream healthy lifestyle factors? If so, how do we reorientate our existing prevention resources to this end?
Look, the short answer is I don't know. I hope so. I think there is an opportunity, and I think it's a great opportunity, and it's a great question. But I don't think it's just going to naturally happen, and I think it's actually something that we as a public health community are going to really need to jump on and accelerate. So, you know, we've talked about this fundamentally being it is a pandemic. It's a pandemic of infectious disease. It's a pandemic of economic. It's a global economic pandemic as well as a result. And if we're not careful, it will be a pandemic of inequity that results from both of those and is accelerated by both of those. So I think the opportunity for us to step outside of the public health space and speak with colleagues from other ministries, other sectors who are focused on things like JobKeeper or JobSeeker, who are focused on ensuring people continue to be able to afford their mortgages, to get access to and afford good food for those who are losing their jobs, that there is an adequate safety net. It might be about us sort of not necessarily having to have everything framed in a health lens, but us seeing the opportunity to work through others and with others outside of the health sector to achieve those social determinants. it might involve some creativity and some humility on the part of public health, but I think it's a huge opportunity. And again, we need to make sure that this pandemic, this economic and infectious pandemic, doesn't become a global pandemic of health inequality and health inequity.
Thanks. And this last question I'll put out to the panel and get a volunteer to answer. So an audience member is really interested in how prevention programs can best prepare for post-COVID funding and grants, as well as changes to health priorities.
Well, maybe as a grant giving organisation, I'll jump in and just say that we do plan to, as soon as September, there will be some new major grant rounds opening up from VicHealth. These will be for a range of different partners from the research community, from the public health community, but also, of course, from communities across Victoria, grassroots community sectors and sport and arts communities as well. So we realise that there is recovery that needs to be done. That's led by government and funded by government, but we see an opportunity to really strategically spend our dollars on ensuring that those inequities are mitigated, that we're able to scale the positive solutions that have cropped up through coronavirus, and they're able to work with partners like Cancer Council, OPC, and of course, a big shout out to Mildura. I love your part of the state and can't wait to come up and visit very soon. Very jealous of your weather. Working with those partners to make sure that we're able to deliver strong value. So there will be, we do expect to increase and announce some fairly significant funding in the coming months, and you'll be able to track that through our website.
Thanks so much, Sandro. And it's amazing to see our engaged audience and all the questions that are coming through that we unfortunately won't have a chance to answer today. But I do urge you all to tune in to the second prevention-focused online event that VicHealth is running as part of their fantastic Life and Health Reimagined series on the 16th of July. Please hold over your questions for that event. I would like to sincerely thank all panel members for joining today, and all of you, I hope you've found it as fascinating as I have. Thank you so much, everybody. Good afternoon.